Can you tell us a little bit about like how testosterone replacement therapies work, and in particular how they help with libido and function?
So, I mean, the key to the whole thing for let's functionally answer that question first is the proper dose, the proper amount, dosing, the proper type of testosterone, and delivered in a way that is going to be consistent in their body to where they get then consistent physiological change and results. And that's what you definitely want. And that when you have that, when you have optimized testosterone, you will have usually optimized libido and therefore function. Not always, but generally speaking, it does help that way for almost all guys, especially in the very beginning. Let's say in the beginning, 40s or 50s. Testosterone should be the foundation of therapy for men when right at the very beginning, when they're thinking, I got some mild ED or some performance anxiety, any of those kind of things. So testosterone. But more specifically, I do testosterone replacement therapy in two main ways. I use subcutaneous hormone pellets. So these are small pellets, about 200 milligrams, they're about the size of an eraser head. And men will get 6 to sometimes as many as 10 of those pellets placed subcutaneously underneath the skin on the side of the hip. So it's a very simple, minor surgery procedure that is done. It takes 5 minutes to do it. And the pellets are placed underneath the skin in a painless way. And then those pellets will then secrete testosterone consistently for 4 to 6 months. So it's a set it and forget it. The pellets are there. The hormone is gradually being, released based on metabolic rate, based on exercise levels, but it's always there for you. It's a very profound way to be able to deliver hormone because you get that consistency. If pellets are not an option for a guy who doesn't want that, then we will do injections. But injections is a pretty common way to do testosterone replacement therapy, but I've developed a way to do it using a subcutaneous needle. So instead of the larger intramuscular needle that is more classically done, let's say once a week for a guy, we will take a smaller needle and split the dose in half, and they do a twice weekly injection, subcutaneous into the stomach fat. And very, very simple injection. This all can be self-administered. We teach them how to do it at home. And that will keep the levels incredibly consistent as well. So the upside of the pellets is you set it and you forget it. A guy comes maybe 2, never more than 3 times a year to have his procedure done. It's simple. The downside with pellets is you have to go 7 days with no exercise, and there's certain restrictions. Sometimes there could be extrusion or infection with the pellets. It's rare, but it happens. So those are some of the downsides. The upside to the injections is there's no restrictions to exercise or anything like that. Very easy that way, but you got to give yourself an injection 2 times a week. So the patient just has to kind of pick what's best for their lifestyle. But either way, both of those methods work extremely well for men.